Good morning, welcome to Sports Radio 1310, The Ticket. George DiGianni on the Train Station Fitness Show. If you've not heard this show before, what we do to help you, since I don't have call-ins too often, is I bring in a panel of experts. Tina Burnett Allen is in the studio, great trainer in person in Dallas-Fort Worth, and also Dr. Kevin Light is in the studio, where it's called the All About You Show. And this show really has no topic. We may talk about certain things just to get the ball rolling, but make this show your own by calling us and discussing what struggles you have, what concerns you may have. The number is 888-787-1310. You can call from anywhere when you're listening to us on the radio in your car or at home, or listening to us on the internet. I noticed some people, particularly women, still struggle with their same routine, going in the gym and going on right to a piece of aerobic equipment. And I notice what men still in their routine, where they're doing the same things over and over again and not getting results. And then I thought, well, does it really matter? I mean, if they're not complaining and they seem fine, does it really matter? And to a degree, it doesn't. But then again, maybe if we're able to give some education and some points that people can apply to their lives, they might not deal with the ramifications of moving the weight the wrong way, right? Shoulder injuries, knee injuries, hip injuries, and so forth. And maybe if we can share some benefits, like I was out a few nights ago with a few friends of mine, and a female said, you know, I've been doing aerobic training forever, and she goes, I started using weights, and over the past couple months I've lost 15 pounds. And she goes, I never would have thought that. And I said, yeah, you know, you're changing the muscle to fat ratio, and we talked about it a little bit, but it's still dumbfounding to me how people just don't get it, particularly women.
Yeah. I was at the bank yesterday, and the teller was telling me she's noticed I was a trainer, and I was making some deposits, and she was a very overweight woman. I mean, like obese overweight, and she had been through some sickness and in a position where she she gained a bunch of weight because of medicines and stuff she was on. Anyway, she was telling me how she's started on this 800 calorie a day diet that her doctor put her on, and she couldn't do MedFast because she couldn't afford MedFast. So he had her doing the lean body shakes, and then only eating chicken and half a chicken and some vegetables. And she asked me if she thought she could, you know, have carbs or whatever like that. And she said she's doing aerobic exercise. And she said, do you have any tips? I said, yeah, you need to not do 800 calories a day and do some weight training. And I kind of talked to her for a little while, and she had no idea, but she said, well, my doctor told me that I should do this, so I think I've already lost 28 pounds. You know, but it's typical because she's going to lose weight, muscle, and fat, and be a smaller version of herself.
Well, no, let's talk about this coming up next a little bit, and somebody else might want to chime in if they want to give us a call. 888-787-1310 if you struggle with this, or whether you're in the profession or you're a person who is obese and you wonder why you go on a particular type of diet, even if it's a diet that will help maintain your metabolism so it doesn't slow it down with an 800 calorie a day diet. What is something that we've discussed on the show before that can create this plateau? And we'll discuss that coming up next. So remember, this is the All About You show. Any questions, any concerns you have, by the way, I'm gone for a month. I'm leaving town tomorrow. Boom. So if you want to get all right. The support is overwhelming. So if you want to get some questions out, some things you've been thinking of for a while, I won't be able to be on Facebook as much and respond to people. So let's talk about it today. 888-787-1310 with Dr. Kevin Light and Tina Burnett Allen. 705 Sports Radio 1310, The Ticket. The Train Station Fitness Show. My guests in the studio, Dr. Kevin Light and also Tina Burnett Allen, trainer in Dallas, Fort Worth. This is the All About You show, and you get to be in the director's seat by calling us and telling us what you would like to discuss. 888-787-1310. One of the things Tina mentioned in the first part of the show was something I wanted to comment on, about how you can be on a particular diet, even though some people are on an 800 calorie a day diet, which is not enough to support your metabolism. But even if you were on a diet that supported your metabolism from the amount of calories you had, it doesn't mean you're going to lose a whole lot of weight. There's going to be a stopping point. And the number one reason we know that is because of nutrient deficiency. And we know also that even if you're getting the proper nutrients in, your body might not be receptive to them. It might not be absorbing them. So if it doesn't absorb them, then where do you go from there? And this is when you need this more in-depth testing. Dr. Kevin Light does this, where you go to his office and he does hormone replacement therapy. I am on his hormone replacement therapy. It's worked very, very well for me over the last 8 years or so. And Dr. Jeremy Webster does testing as well. And once you find what you're deficient in, you can replace the nutrients that you're not getting, find out why you're not getting them, then absorb them. And while you're on that diet you're trying so hard on, you can then gain the benefits of it. You mentioned something after I said, well, hold on, save that, because we were on a break. Where were you going earlier? Tina said, I want to hear that. And I stopped you and said, save it for the radio.
I don't know, remind me.
Which one was it?
Oh my God. Okay, so
we were talking about, well, and then we talked about this, what it takes to but I don't think that was
they're
it.
talking about people with weight loss, and they did statistical studies. I just saw this study, and the majority of people who try to lose weight cannot sustain it, and by 10 years, 99% of them or so have lost that weight back. But
gain the weight back.
Gain the weight. I'm sorry, and then within 2 to 3 years, actually, is when most people really start to fail quick. But the people who make it, they found that the most predictive value of people who stay with the program and have success, however that's defined, is if you can maintain a fitness program of any kind on a regular basis for greater than 6 months, that determines who, in general, will make it or not. I guess it's a sign of commitment or devotion, or whatever. But those people who maintain a fitness regimen for greater than 6 months have by far greater success.
Consistency, right?
Yeah.
Being consistent.
Yeah,
if you're consistently eating like crap, you're going to get consistently bad results. And
but it's not the caloric load. It's not the type of foods they eat. It was with all diets.
Mm-hmm.
With all, pick one, South Beach. Any little label diet. If you can maintain a fitness regimen more than 6 months, they had greater success. All other things not considered. Yeah.
All right, it's the All About You show. We're taking questions today. We do not have the topic because the topic is you. So direct the show today. If you want to call us, 888-787-1310. I know people are listening all over the world, so get up and give us a shout. Right now, let's go to Brent in Richardson. Brent, you're on the ticket.
Hey, folks.
Hi.
I'm now in my early 40s, and I just wanted to see what you guys, what your take is on HGH, particularly for fitness and weight loss goals.
Okay, so Dr. Light.
Human growth hormone for weight loss?
Yeah, he's gone.
Yeah.
And
Okay.
fitness goals.
Fitness goals. Well, HGH, a lot of times when you engage in appropriate fitness, especially in your 30s, you will naturally increase your HGH without any supplementation. So the human HGH deficiency is kind of unusual, and if it's below a certain point, usually or less than 170, and you have symptoms associated with that, then supplementation may help you.
What are some of the symptoms associated with low HGH?
Low HGH, you have general sense of loss of well-being, you get mental clarity issues, you get a little fatigue.
Weight gain.
A lot of it is weight gain, but a lot of it is you lose your motivation, almost like testosterone. You can't stay on task. Your memory gets a little fuzzy. You get a little more emotional. You get a little depressed.
Immune system's low.
Mm-hmm.
But wasn't he talking about the HGH diet?
I think there's HCG
The
diet.
HCG.
HCG
Okay, that's what I was.
diet,
HCG.
But a lot of people
okay.
go on HGH thinking it's going to really buff them up and really add considerably to lean body mass and fitness, and that's just not so.
It's not, and I've mentioned that before. They say, what if I take a whole lot of it? Well, people may not recognize if you take that is where it benefits you is by age 16, right? Not past that, am I correct? With growth plates closing and so forth, right?
Right.
So that's where it would benefit you from a point of growth, whether that be bone or muscle and connective tissue and so forth. But it'll also help you with fat loss. Here's the problem, and I'd like for you to comment on this real fast. HGH supplementation and people who are prone to being diabetic, the dangers of that.
Well, HGH will increase insulin resistance. because HGH is the IGF-1 moiety is similar to the IGF-1 moiety people have who are insulin resistant, and so people who have any sort of sugar dysglycemia, if they're on HGH, it's going to make that worse.
Now, what does that mean, sugar dysglycemia?
If they tend to run high blood sugars.
If you have high blood sugar and you take HGH, it's going to exacerbate the condition, right?
In many cases, not always, but in many cases, yeah. So it's something really to watch out for. And if you're frankly just overtly diabetic, then you really don't want to use it at all.
Okay, good. And people think fat loss, they'll do anything for it, not recognizing that something can make you worse, hence the reason for getting tested. So, the All About You show, what do you want to discuss today? I'm going out of town for a month. I won't be here. I won't have a show until the 8th of June, I believe. So, let's have you benefit from this show and go in any direction you want. 888-787-1310. Right now, let's go to John in Plano. Hey, John.
Hi. Hey, I've got a question. You mentioned something a minute ago about absorption or malabsorption, and my issue is not with me, it's my son. He's 24 years old. He's had too many issues his whole life to get into it, but he's got some developmental delay problems as well. He has always been very, very small and skinny. Now, he works out, and he's got good muscle tone. He works out with a trainer at least 2 days a week, mostly lifting weights. He doesn't do a lot of aerobics. But he can't gain weight. So let me give you an example. He's 24 years old, and he probably weighs 105 pounds.
How tall?
And he's probably 5'1" or so.
Okay. That is...
And you were mentioning the doctor about that they can test you about if you're not absorbing certain nutrients or something. And we've had a lot of different specialists look at him over the years, and he's had some problems like syringomyelia and Chiari malformation when he was really young, and then he had scoliosis surgery when he was probably 16 years old or something like that.
So John, let me interrupt you for a moment, because this is obviously this is a condition that needs special attention, and I'm sure you're aware of that. And it's not something that can be discussed on the radio, nor should it be diagnosed on the radio in any way. If he's not absorbing nutrients, that's certainly an issue that needs to be addressed. But maybe the issue can be addressed by using someone who understands nutrition at a very in-depth level, more than specialists who may not agree with or understand nutrition, just looking at it from a different angle. And what I'd like for you to do, Dr. Light, you want me to send him to Dr. Webster?
Yes.
So I'd like for you to get in touch with Dr. Webster. He does some in-depth analysis of nutrients that are being absorbed or not being absorbed, and he may have another take on this for you, because this would really work. And I'm going to give you his number out, and if you have trouble remembering that, you can always email me later, and I'll send it to you. Okay, it's 972 735-0707, 972-735-0707. Give him a shout. Tell him you called us on the show and see how we can help you out.
Okay, I'll do that.
Thanks, John.
Yeah. Thank you.
Let's go to Joe. Joe on the cell phone. You are on the ticket.
Yeah, hi. I had a question really about my daughter, 14-year-old daughter that's overweight. She's just about 5 foot tall, weighs about 145, and she's tried a lot of different things. Obviously, at 14, she doesn't have quite the self-discipline that somebody older would, but she's tried a lot of that burst training and, some of those high school courses where they do a lot of sprints and a lot of weightlifting. And when she did that, she actually got bigger and heavier. And so I guess I'm wondering if you guys have seen, with women, maybe a different response a little bit than men as far as that type of activity goes.
Joe, that's a fantastic question, and I'm going to say absolutely not. If she performed burst training properly, there's two things that stand out. I'm going to let Tina comment also. There's two things that stand out for me, and Tina, and tell me if you need to expand upon these even more. One, she may not be performing burst training properly, where there's not enough rest. She's keeping herself out of breath. Therefore, she's creating chronic inflammation, which makes you lose muscle and gain more fat. The other thing is, one of the things we know, Joe, that this happened about... Do you guys remember a study that came out about a year or two ago where it said exercise makes you fat? Do you remember that? Well, so basically, what the nuts and bolts of the study was is the more you exercise, the more it increased your metabolism, the more hungry it made you be. So what did it come down to? It came down to taking responsibility in the choices of the foods that went in your mouth.
Yeah.
And so that's what stands out for me, Joe, is a couple of things. Children learn by example, and I don't know if anyone in your family has the same issue she does.
Not at all. That's the other thing. We have 4 other people, and they all are very, work out a lot. Nobody's overweight. I have athletes that have college scholarships, but the little one just seems to...
The second thing that comes to mind is sometimes there's something happen emotionally to the child. They can also be doing closet eating. Third, do you know what she eats throughout the day? Has she kept a journal for a week? If it's a sensitive topic to her, that may be one of the reasons she has this issue in the first place. Third, I would also have her be set up with some type of nutritionist, and I would certainly have her get with Tina at least one time to see if she's performing burst training properly, because you can be doing this the wrong way and it could actually affect you adversely just by doing something that we tell people not to do, paced training. Getting on a bike or jogging or whatever it is. So I want to let Tina give her number out to you, or her email to you and others, because this is a real good topic. Saying, hey, somebody in my family is over fat, but it's not succinct with the rest of the family. Why? What comes to your mind?
Well, I mean, I have a 15-year-old, and she went through a period where she put on weight and got heavy, and partly because she was injured and couldn't work out. But once she did start working out, the workouts did help, but a lot of what changed was her diet. She was closet eating. And I figured it out down the road that she was sneaking food late at night, and we'd find, remnants of that food.
Right.
So I think that's a big thing. I've also worked with a couple other just recently girls that are in that age that are overweight, and it really does kind of come down to, are they doing their workouts correctly, and what are they eating that maybe you don't realize is going on.
Yeah, also, the last thing I would say is the food in your house, if it's not healthy food, you may want to take that out of the house. And the reason I say that is if you get a negative response from your daughter, then that only validates Tina's point more. Different ways to look at this, but I'm going to have Tina give her email out here in a moment, and then we'll come back and we'll talk about that in a little bit. Okay, Joe?
Yeah, thank you very much.
Thank you so much. Coming up next, the All About You Show. Do you have questions? Would you like to be in the director's chair about how we can help you? We may not have helped you with your specific condition, but we'll guide you to the people who can help you and make it more in-depth for your needs, for your desires. I'll bet we can do the majority of it here on the show. Keep the number, 888-787-1310. It's 727 Sports Radio 1310, The Ticket.
Coming up.
So we have the All About You Show, and if you're trying to call, we're going to go through some of these calls right now, and you can give us a call. It's anything you would like to discuss today as it has to deal with health and fitness on the show, 888-787-1310. Let's go to Tom on the cell phone. Tom, you're on the ticket.
Yeah, I'd like to get your opinion on the difference between... I'm on testosterone therapy. I'm 50 years old. I've been doing it for about 10 years. I take 1 cc every 5 days. The difference between injectable and implants.
Well, I have strong opinions about that. Number one, so you said you're 55 years old, correct?
50.
50, okay, so let's presume you want to stay feeling good until you're 80 years old. That's 30 years.
He's gone.
He's gone?
Well, Dave let him go.
Okay, so for 30 years, every 3 to 4 months, you're going to have a surgical procedure performed. That doesn't make very much sense to me. Also, if I put in testosterone pellets into you, and I misdose you, and give you too much, which sometimes happens because your needs change throughout the year. What do I do about that? I just wait till they dissolve? Do I go and take those pellets out? And the third issue is the pellets, in many cases, especially if you get them from compounding pharmacies, although they're presumably sterile, the reality is they're just sort of kind of sterile, and so there's an infectious thing to deal with. So I don't like pellets. I know they're convenient, and I just think that it's really hard to dose in a dynamic fashion using pellets. Having said that, I personally like creams. Creams are more physiologic. You can get levels that are very, very high, and you can use it every day. The shot is a nice intermediate way of doing things because you take it once a week, but you get this spike around 2 or 3 or 4 days, actually about 4 days after you take the shot. So that's okay for people who are really busy and on the run, but I don't really have much good to say about pellets.
Yeah, I
myself.
like the cream the best also. Tina, your email for everyone, please.
Fitness.tina@gmail.com.
Dave, let's go to Glenn. Glenn in Denton, you are on the ticket. Hi, Glenn.
Yeah, thanks for taking my call. Just want to know your opinions about the Gracie diet or food combining or like an alkaline-based diet.
Okay, well,
Overall
that's
health.
actually 3 questions. Which one's most important to you?
I'd say probably maybe the alkaline in terms of overall health.
Okay, good question. So you guys want to get into that? Anybody here?
I can.
Well, the alkaline diet,
Alkaline.
becoming more alkaline. How do you do that? Let's just
Oh.
blanket it instead of saying there's one particular diet for it. We know that vegetables will make you more alkaline, and we got to keep something in mind when we talk about alkaline versus acidity, being acidic rather. There's a balance. It's called pH balance. You don't want to be too alkaline or too acidic. We have to have a balance to help create the balance, since most things put us in an acidic environment. Stress, the wrong food, being overweight, all of those things make you acidic. Even having the wrong beverages make you acidic. And we're mostly acidic. So people say, I want to be alkaline. What do? Vegetables will help you do that. Apple cider vinegar have that, especially since women have trouble with bloating and digesting vegetables. Apple cider vinegar, have a tablespoon every single day. You can have it on salads or just I drink mine every day. Have lemon in your water. You can do that every single day as well. And these are things that make you more alkaline, but they don't make you alkaline versus acidic. It's important for people to know that. Any comments before we go on, because we've got a lot of calls.
Go for it.
Anybody? Let's go to Mir in Prosper. Go ahead, Mir.
Hey, Hey, George, how you doing? So
Good.
I want to give you a background. I'm 35 years old, diabetic. Who was diagnosed about 3 years ago. And my doctor basically he's got me on metformin, and he told me that I'm due to a low protein called GLP-1. He's got me on a shot that made me drop my weight from 193 in November down to 155 now. I'm trying to figure out if I go to work out and start trying to do some exercise. I have zero appetite right now, like very little appetite. What would you recommend as far as foods maybe to eat?
Well, Mir, hold on. Is that a side effect of the drug?
Yeah, that's a side effect of the drug. It's lost appetite.
The only thing I can tell you, and if you guys have better information than I do, next to me, Dr. Kevin Light or Tina Burnett Allen, is if you're not hungry, drink your calories. And I don't mean alcohol, but I mean protein shakes and throwing fibers in there and other ways to drink your calories, because it might be harder to consume them. And I have no other way around that other than telling you to do that. Any ideas, guys?
No,
Really.
That's a tough question.
That
If
is
you're
a
not
tough
hungry,
question.
it's one thing for people to condition themselves. You wake up in the morning, you've not eaten for a while, and you've conditioned yourself not to do that. Therefore, a lot of women say, well, I'm not hungry in the morning. Well, you've conditioned yourself to be that way, and you have to recondition yourself. Mir has a case where he's on a drug that is making him not, it's not a conditioning issue. It's a side effect. So how do you force that?
well, the important thing after exercise, of course, as you know, if you're going to build muscle mass, is you have to supply protein
Right.
quick, either during,
When
it's definitely after your workout, and you have to do it a lot of times within 45 minutes. And so that protein, they've done studies to show that the muscle hypertrophy with protein immediately afterwards and with no protein is night and day. So you have to have that protein, and probably the most direct mainline way to do it is, like, as you said, to drink it, have a nice
Protein shake.
strong protein
Yeah,
shake.
because most often after we finish exercising, nobody's hungry. So how do you get the protein in you? The best way to do it is a shake. And I hate that I couldn't help him further, but how do you do that when it's not a conditioning issue? I just don't know any other way to do it than to puree some foods, even if it's chicken, like you're going to feed a baby, and you feed a baby your own food versus something you're going to buy, and drinking calories that way. But you've got to get your calories in. Let's go to Richard in Fort Worth. Richard, you're on the ticket.
Yes, sir. I have an argument with my wife. She likes to make lemonade, fresh lemons, put it into water with a little bit of Splenda. I say it's better to drink plain old everyday water rather than the lemon water. Who's right here?
All right, so what stands out, and I'll share this with you, is very important. You're both right. Your wife, by putting lemons in the water, is right. It makes you a little more alkaline. It's very good for you. However, the Splenda is very bad for you. I don't care if people say it's 2 sugar molecules they put together. It's now chemicals they've put together. It's not real sugar. I would use something called stevia or xylitol to make the lemonade, and now you're safe all around. Tap water, not a fan of it, but I would always put lemons in my water, like I said, because we're mostly acidic. Let's move to the next call. Let's go to Ray in Irving. You're on the ticket, Ray. Go ahead.
Good morning, George. Thank you so much for doing your show over the years. I love it. I've got a lot out of it.
Thank you, Ray.
Good. You bet. I'm 6 foot tall. I'm 35 years old. I'm 180 pounds. I burst train 3 to 4 days a week, thanks to you. I have 14.1% body fat. I've been trying to get below that for quite a while. I actually went 4 months on a pretty much zero carb diet, high in vegetables, high in protein, fairly low in fruit unless I needed it for energy. I cannot get below that, and I'm in pretty good shape, but I can't see my last couple
Ray,
of
I'm going to tell you this is the Tina, you want to answer this first and then I'll come with it? Don't have much time, but go ahead.
Well,
I think I know what it is and I would bet money on it. But go ahead, you want to go?
the workout? Changing? No.
If he's doing burst training properly, he sounds like he's on it. He sounds like he's on it. So let's give him the benefit of the doubt. My guess is that he's losing so many nutrients. He's deficient in certain nutrients like zinc, a B complex, and if you're deficient in those and you don't have those properly, you don't have proper metabolizing properties for fat loss.
So
that's the first thing that comes to mind.
Needs to have the testing done to see where he's deficient.
You can do one of two things, Ray. You can call Dr. Webster 972-735-0707. Have testing performed to find out if you're deficient in certain nutrients, which will help your metabolism, or you can take the more inexpensive way first and add 50 to 100 milligrams of zinc in every single day. Make sure you eat with it, okay? Split it up throughout the day, twice a day. Same thing with a B complex as well as a B12 supplement. You put all that together, you'll find that you'll increase your metabolism, and it's really, really healthy for you to do that, but have those supplements with food. And that's a suggestion for everyone. If you don't notice a difference, give it a month and a half, then go to Dr. Webster if you want to do that. Dr. Light, any other?
Yeah, there's another thing for people who can't lose weight, who are doing all the right things. The fat is nature's way of locking up environmental toxins. So if you are a type of person who are exposed to a lot of toxins, you will maintain a certain level of fat just to keep that all locked up. So if you can get rid of that, that'll help. Yeah,
using my 21-day cleanse will certainly help with that as well. Many people don't realize toxins are held in fat cells, and if you don't release them, it may be harder to lose weight. So coming up next, it's still the All About You show. We're going to 8:05 today. The T-Box is not here, so we'll have a good amount of time to speak with you. Give us a shout. Talk about your issues, your concerns. It's your show. It's the All About You show. 888-787-1310 at 745. Sports Radio 1310, The Ticket. 754, Sports Radio 1310, The Ticket. George DiGianni, Train Station Fitness Show. This is the All About You show. And we're taking calls today. We've got a few people on the line. If you want to give us a call, 888-787-1310. Dr. Kevin Light is in the studio, as well as Tina Burnett Allen. Tina, give your email out again, and then Dr. Light.
fitness.tina@gmail.com.
If you think you're performing burst training properly but not gaining the benefits, you could do one of two things. You can use Tina, or you can get my 30-day fat loss program you've heard me talk about on commercials. Either way, we'll teach you how to perform burst training properly. Mine come with a couple of videos, and one video right now, the other one's being loaded. You can use that. Dr. Kevin Light can help you as well with hormone replacement therapy. How do people get in touch with you? Dallas Healthy Aging?
DallasHealthyAging.com.
Oh, that's easy. DallasHealthyAging.com. Right now, let's go to Travis. Travis, you're on the ticket.
Good morning. Thank you for taking my call.
You're welcome.
I'm 27 years old. Just moved back to Dallas, and I'm looking for a new primary care physician. And maybe Dr. Light can shed some light on this, but I'm looking for a doctor that will actually listen to me and provide health care that's focused on prevention and not just throwing a bunch of drugs at me and finding a quick fix. What do I look for in a doctor's history, or what are some things that I can look for that can help me find a doctor like this, or am I stuck just being my own advocate?
No, I mean, there's a growing movement among physicians in the healthcare industry to be just that kind of doctor. And you want to look for key terms like functional medicine, integrative medicine, even alternative medicine. Those are the docs who actually sit and listen to people. Unfortunately, with medicine today, in an insurance-based model, in order for doctors to make money, they have about 7 minutes to see you and then you're out the door. So you may have to come out of pocket for a doctor like that.
Yeah, for the doctor, Travis, good way to think. I love that you want to take your health into your own hands with the guidance and support of a doctor who understands nutrition as well. The functional medicine doctor, I would certainly look for integrative medicine. We don't have anyone specific to mention, but I love that you're going in that direction. Let's go to Rob. Rob and Addison, you are on the ticket.
Hey, George. Thank you for having me on the show today.
You're welcome.
George, my question is about 2 weeks ago, you were stating that sleep cycles and how important they are, and especially about that you had to be asleep about 11:30 p.m. because at 1 o'clock the HGH in the body regenerates itself, basically. Now, my thing is the last 6 months I've been working overnight. Not only am I not working overnight where I'm sleeping during the day, but I also have a very severe sleep apnea. With that, I'm also seeing that my body's kind of gaining a little weight on body fat and losing its muscle tissue. What advice can you give me?
Wow, Rob, that's first of all, fantastic memory. I love your memory. Secondly, that is exactly what happens. It validates my point. If you're a person who's gaining weight and you don't understand why, maybe you're having alcohol at night or some other type of carbohydrate that's disrupting your sleep that doesn't allow you to release growth hormone. Maybe you go to sleep too late at night and you're not releasing the proper amount of growth hormone. Therefore, you start to get the disadvantages of not having proper growth hormone release. Fat gain, lowered immune system, tired, sleep apnea issues, and that is the importance of changing that. Dr. Light, I honestly can't answer him because if your work environment tells you have to work at a certain time at night, we don't really make up for it, do we? Do we actually change our sleep cycles?
You can if you have the help of melatonin. It's just like
I hate melatonin. It doesn't work for me.
I'm sorry to hear that, but I'm telling you that it does work for normal mortals. If in many cases,
that means you're not normal.
No kidding.
If you want to change up your sleep cycles, and the other thing, the normal diurnal or the daily rhythm of cortisol is it's high in the morning and low at night. When that gets turned on its head, then you have sleep difficulties. When your cortisol pops up at night. In and of itself, just having sleep deprivation causes your body stress, which means you're going to be cortisol crazy, and that's going to cause a whole set of problems itself. So I would start with some sort of natural supplement like melatonin.
You would start with. Here's the problem I've had with melatonin. Thank you for the call. Is that I can sleep with it, but inevitably, I don't care if I take 3 milligrams, 6 milligrams, or 9 milligrams, I wake up at 2:30. 2:30. If I don't take it, I'll sleep through the night. Now, I've also had a pregnenolone issue that we discussed, but I took it recently and it didn't work for me where I slept through the night, so I stopped taking it now. And that's me. But you know what? For him, to help him out, hopefully melatonin will help him.
Be a good start.
Yeah, let's go to Dave. Dave,
long-time listener.
You're on the show, Dave. Go ahead.
Okay. Thank you, George. I'm a long-time listener, big fan.
Thank you.
I have a question on burst training. If I'm sprinting as fast as I can for 25 seconds, how long should that rest period be? I hear different things from 20 seconds or to up to 2 minutes.
That's a fantastic answer. And you know what? I don't care if you have to rest for a half hour. There's no wrong amount of time to rest. 0. Because whatever it is for you to recover is the amount of time you need to recover, so you can therefore put out 100% effort again. Another thing you could do if you find yourself taking 3 minutes to rest, Tina, to chime in on this. If you find yourself taking 3 minutes or 4 minutes to rest, instead of burst training for 25 seconds, do it for 10 seconds or 15 seconds and then build up in your intensity. Because what you'll find is that your recovery time between sets will decrease as time goes by, provided you're giving yourself enough recovery time.
Yeah, I tell people, I mean, I like using the perceived exertion model, but once you've exerted yourself enough to where you, like you said, burn out within 20-25 seconds, and then recovery time is, like if you're sprinting, walking, just kind of keep moving and walking, and once your heart rate comes down to where you kind of have to use a little trial and error and see what then try to sprint again, and if you feel like you didn't get enough rest, then maybe next time to take it a little bit longer, but kind of keep track of how long you are taking, have a little stopwatch and keep track of what your recovery time is, because it will decrease as I don't know how long you've been burst training, but it will decrease your recovery time the more you do it.
You can also use a heart rate monitor.
Yeah.
So what I'll do if I burst train on a stationary bike in the gym, I'll warm up for about 4 or 5 minutes. I'll put the intensity as high as I possibly can and ride as hard as I can for 30 seconds, and then I'll slow down to the point where the bike is almost turning off, and I have the intensity down to level 1 or 2. I have my hands on the heart rate monitor, and when I come down to 119 beats per minute, I go again. I hit it hard. Or you can say the perceived exertion model, supercalifragilisticexpialidocious, which we have all heard of. If you can do that without having to take a breath or feeling the need to take a breath and right away, that may be a good indicator also. So there's a couple of ways you can look at that. But people must realize the importance of rest between bouts of burst is just as important as the intensity of the burst. If you don't do that, you're not performing burst training, you're doing HIIT or circuit training.
Right, and you won't be able to create the intensity. If you don't recover long enough, and that's where people get injured. They're going non-stop and they're not recovering and hitting something else high intensity, and then all of a sudden,
form suffers.
Yeah.
Right.
Right, and then all of a sudden, form suffers, and then you get, torn. I've had a girl tear her Achilles tendon off doing that Insanity video.
Oh, gosh.
Just non-stop. That's why they call it Insanity.
Let's go to Justin in Fort Worth. Last call. Go ahead, Justin.
Yes, thank you for the call. I was curious if any of y'all have seen the movie or the documentary called Doctor. If you haven't, I know a few months ago you had a show talking about just kind of how a lot of the healthcare in America has been paid for by large pharmaceutical companies, and if I would like kind of your opinion on it as far as what should be the next step as a consumer, to help kind of make that transition away from this large pharmaceutical based to more of a holistic healthcare model.
Great question, Justin. We don't have enough time to answer that in its entirety, but let's go ahead and everybody take a stab at it. We've got literally a minute and a half. Watch the clock go.
Justin, you just have to take your health care in your own hands because no one else is going to do it for you. And you're right, it's pharmacy driven, and it's all we're taught in med schools, so it's the more progressive doctors who get out of that rut. But you basically have to just be very critical in who you choose to take care of your health.
Tina?
Yeah, I think it is. I think there are doctors now that are starting to think outside of the box, and it may be a little bit of trial and error and going through a few before you find the right one.
Supply and demand, right? Or desire. These National Enquirer type magazines and themselves. If there's no audience to buy it, they can't make it, they'll go out of business. And it's the same thing with drugs. However, the problem here is the people who really can make the biggest impact on Big Pharma running the country, so to speak, are the ones that are not listening to this show. It's the people that don't know, the people that don't care, and the ones that don't know what they don't know. And so the people listening to this show, in my opinion, are the ones that can make the biggest impact on the people who don't know. Let's educate them and point them in the right direction to show them where they can benefit by taking their health into their own hands, not necessarily taking their own pills or getting off their own medication, because that's dangerous, but finding the proper healthcare provider that understands both the benefits of medicine and the benefits of nutritional preventative medicine. Okay? So guys, I want to thank you for coming on. We have to go. It's 8:05, Sports Radio 1310, The Ticket. We'll see you in a month.